Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. We've read and heard a lot about concussion in athletes of all ages and skill levels, but it may surprise you to learn that the leading cause of concussion is not sports related. Actually, the number one cause of concussion is falling. And that's why young children and older adults are most at risk. In fact, the National Institutes of Health reports that falls cause more than 60% of head injuries in older adults. So what exactly is concussion? And how can you lower your risk of getting one? And why should it never be considered just a concussion? We'll answer those questions and more with Dr. Javier Cárdenas, Director of the Concussion and Brain Injury Center at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Cardenas, to Live Healthy West Virginia.
Thank you for having me. I'm really excited to be here.
Well, we're thrilled to have you here. So let's just start with the basic. What exactly is a concussion?
So a concussion represents the mildest form of a traumatic brain injury. Now, in order to have a traumatic brain injury, there needs to be a physical trauma.
Okay.
And so this distinguishes things of traumatic brain injury from, say, stroke or from infection of the brain, those kinds of things that can clearly injure the brain but are not physically traumatic. So you have to have a physical trauma and then a change in brain function. And this is important because people worry, especially when you have little kids, that every hit to the head is a concussion. That's not the case. You have to have a hit to the head or a blow to the body that is transmitted to the head with a change in brain function. Now, everybody thinks of being knocked out. That's
Yes.
true. That's the most obvious change in brain function, but it's not the most common. The most common is actually a gap in memory. So they may remember something leading up. So in athletes, we see they're running down the field. Next thing you know, somebody's helping them up. Or you're in a car accident. You remember being at the light. Next thing you know, your car is turned sideways and somebody's knocking at your window. That gap in memory doesn't need to be big. But you can also be confused, dizzy, see stars, just like in the cartoons, or hear ringing in your ears. That represents a change in brain function and therefore a traumatic brain injury.
Wow. That's a lot, but it happens a lot, doesn't it?
It does. It does. Millions of times every year in this country.
Okay, now you said it was concussion is a mild brain injury. Why should a concussion, though, never be considered, it's just a concussion?
Even though it's mild, we know that the consequences can be problematic for anybody who is working, a kid who is going to school, or we don't always know, is this a concussion or is this something worse? And here's how we want to make sure that we understand that. So first off, when somebody has a concussion, especially when we're talking about kids, we want to make sure we don't put them into a position to get another concussion before they're fully recovered, because that's when we see terrible things happen. That's when we see that second concussion leading to something worse, like brain bleeding, swelling, death, disability. And then for our older population, what we're looking for is, does anything worsen? Because we expect a lot of symptoms to happen within the first 24, 48, maybe 72 hours, and then we expect things to get better. When they're not getting better, that's when we worry, was this worse than a concussion? So we don't want to downplay it, we don't want to dismiss it, we want to be thoughtful about it. But the great thing is, when it comes to a concussion, most people have a full recovery in a matter of weeks.
Which is good to know. Now, you were talking about adults and older people and young children. And I did mention earlier, the number one cause of concussion, it's not sports related, it's falls. So you're not surprised by that, are you?
Not at all. So what's interesting is what has happened is sports has opened people's eyes to concussion. In fact, when we talk about the story around concussion and brain injury, even though it's clearly been there the whole time, we look at the first chapter of this concussion and brain injury story as our veterans from Iraq and Afghanistan. The signature war injury for those veterans was actually concussion. And the reason is that their protective equipment got better so that they were not dying from head injuries or more severe brain injuries, but they were surviving them. And they're blast injuries, and so we saw this come over. The second chapter is the sports story, where we would see this on Sundays, on TV. We see it in our athletes on the weekends. We see it nationally in sports. And while we used to really applaud those big hits, now we recognize they're not good for us.
No.
And so everybody then said, oh, well, concussion the most common reason must be sports, when in fact it's not. And it really never has been. Motor vehicle crashes used to be, but cars have gotten safer.
Yeah.
We have seat belts, we have airbags, we have stability control, we have crumple zones. The number one cause of concussion is falling. And we see it in two distributions, little kids early on, and then as we get older, which of course our country is aging, and so we're seeing more and more of that. And that is by far the most common cause of concussion, is a fall.
Okay, so if we're talking about falls causing concussions, we have to talk about how do we prevent falls in the older population and the younger population.
Well, in all populations, really, we want to see what we can do to avoid falls. So there are a few things, of course, especially in our aging population, having handrails, making sure that we understand what is the reason for that fall. So, for example, if you have somebody in your family who has movement disorder like Parkinson's disease, those put them at risk for falls. People who are on blood thinners, really important, because we see more and more people on blood thinners. And while they may have a fall or hit their head, and it might seem trivial in terms of how they were hurt, those can actually lead to bleeding because of the blood thinner. And so we want to be really thoughtful about those individuals. And then, believe it or not, pets. We see that our pets get under our feet and people fall and hit their heads.
Absolutely, yeah. Well, I didn't hit my head, but I fell. Yeah, no, that's a really good point. You mentioned that car accidents used to be the number one cause, and things have gotten better. Is there anything else we can do to prevent getting a concussion in a car accident?
Yes. So wearing your seatbelt is definitely the best thing. We used to say and encourage people to fix their old car and do what they can to keep it running, but you might want to take into consideration those new safety features. And they are getting better and safer. Now, they've also gotten heavier for the same reason. In fact, the biggest reason why cars are getting heavier today is because of the safety technology. Right. So you have airbags that seem to come from everywhere now, not just from the steering wheel and not just for the passenger in the front. They also have dual stage airbags where they would explode at a certain impact and velocity, but now that less so. You have lane keeping devices in your car. You have not just speed control, but also using radar, so that when you have your cruise control on, it's not just set at a certain speed, but it's set at a certain speed, but it keeps you from running into the car in front of you. So those are a lot of the new safety features that are really driving those numbers down.
So whether it's a fall, whether it's a car accident or a sports-related injury, how do we know when should we go see the doctor, or when should we go to the emergency department?
Excellent question. So red flags are really the key when we're looking at the injury itself. Yeah. So if somebody gets knocked out, that's a red flag. If they hit their head and they have a seizure, that's a red flag. If they have a worsening headache or they're starting to get confused, that's a red flag. Any red flag, go get seen. Emergency room, ER, or your primary care physician. There's really no question about that. Now, let's say somebody doesn't get knocked out, but they clearly hit their head and they felt woozy, they look a little dizzy, off balance, and they don't feel right, then watch them. And that's perfectly fine. But if they have any worsening of those symptoms, that's when you should really go in, especially if they're at risk. So once again, somebody who is elderly, especially if they're on a blood thinner.
Okay. And what about, now I don't think this still stands, but I just remember we used to be told, if somebody has a concussion, don't let them go to sleep. Does that still stand?
There's a lot of myths around concussion. That's the other thing that we used to see, and that is one of them. So what that came from, and I blame us as physicians for that myth, is with people who have more severe brain injuries, especially a bleed, the first 72 hours is when that bleed is most likely to expand, most likely to grow, and most likely to cause problems in an intensive care unit setting. But for concussion, we want people to rest. We know that resting is good, and so we encourage people after an injury like this to let people rest and let them stay asleep and let them, and you might want to check in on them every so often, maybe tickle their foot just to make sure they move, that kind of a thing.
Yeah.
But no, indeed, you don't need to wake them up every hour. You don't need to keep them up. You don't need to keep them from sleeping. That actually is not good for the brain.
Do you still need to, limit screen time? Stay away from some, bright light, those kind of things. Is that still another myth?
Another myth.
We're myth busting.
Exactly. So along those lines, one of the myths, of course, is that you had to be knocked out in order to have a concussion. We don't. We described, indeed, you simply have to have a change in brain function. On the flip side of things, not every hit to the head is a concussion. Now, when I was playing sports, if I had a concussion while playing sports, but if I was injured, or if people from my generation, they got a pat on the butt and went right back out on the field.
Yeah.
We know that was wrong and that was dangerous. And then the pendulum swung the other way, and we said, if you get a concussion, go into a cold, dark room and come out when you're better.
Yeah.
That's also wrong. Fortunately, not dangerous. However, what we saw is that especially our adolescents, when you isolate them, just like with anybody, you get depressed, you get anxious. And so now what we know is that within 24, 48, 72 hours, rest, perfectly fine. But then we want people to engage in physical activity. We want them to engage in school activity. We want them to engage in social activity. Those things, a screen is not going to cause your brain to swell, not going to cause damage.
Okay.
Running, not going to cause damage to your brain. Could you feel crummy? Yes, indeed. But it is not causing harm to your brain. The only thing that can harm your brain after you've suffered a concussion is hitting your head again.
Hitting it again. So we got to avoid that. All right. What other myths do we need to bust here while we're talking about
this? Those are the big three for sure. The loss of consciousness, waking people up, and then, of course, go into that cold, dark room and avoiding those screens.
All right. So I'm glad we got that all taken care of. So in general, how do we treat a concussion?
So that's the other thing, is indeed concussions are treatable. So that, I would say, is not so much a myth, but really there's an acceptance amongst even healthcare providers that you simply just have to rest and then you'll get better. In fact, there are active things that you can do to help your brain.
What?
Exercise is a treatment for a concussion. Okay?
Wow.
And the reason is you're getting your body engaged, you're getting your brain engaged, and in fact, there are other studies outside of concussion that show that exercise is good for brain health. Same idea.
Sure is.
Other activities include thinking activities. We want people to engage their brain because it's treatment. Now, beyond that, we do balance therapy for people who have a lot of balance problems after a concussion. We do vision therapy for people who have difficulty coordinating their eyes because their brain is having a hard time doing so. We have speech cognitive therapies for people who are having trouble with memory, finding the words, and thinking. All these things are treatments for brain injury. Now, sometimes we use medicines, but the medicines are relatively limited, believe it or not, and the medicines are used to treat things like headaches. So people who have these self-perpetuating headaches, or they've been dealing with headaches for a long time after a concussion, then we'll use medications to help them prevent those headaches.
Okay. Well, we did talk about falls, and we talked about car accidents and other accidents. So we can't leave sports-related injuries out of the discussion here. Now, I have to, I always like bragging about you. You know what you're talking about when it comes especially to sports-related concussion, as you're the senior advisor to the NFL Concussion Program and vice chair of the NFL's Head, Neck, and Spine Committee. You spend a lot of time on the NFL sidelines, don't you?
Yes, I do.
Okay, so since we can't leave sports-related concussions out of the conversation here, how many concussions are too many when they're sports-related? And, when should you stop playing that sport?
Well, the great thing about sports is sports represents a microcosm of our society. The same is true in medicine. So sports medicine in many ways can teach us a lot about how different things happen in the general population. And concussion is a perfect area where we've studied this in great detail when it comes to concussion that we can apply to other populations, whether they represent an older population, whether they represent kids, whether they represent underserved populations like domestic violence survivors.
Oh, yeah.
Now, when it comes to how many concussions are bad, 1. Nobody is encouraging anybody to get a concussion. The question is always, well, how many concussions are too many to do X, Y, or Z? How many are concussions do you need to retire from sports? And there really isn't a magic number. Now, people used to use the number 3. And the reason they use the number 3 is because there were some studies in the past of people who were knocked unconscious multiple times in which they did some thinking tests and they showed some decline in thinking. So here's what we try to do is we try to identify who is having a tough time recovering from their concussion, from any concussion. Could be their first, could be their second, could be their 10th. And that is, number 1, was anything worse than a concussion? Because that's always the challenge is sometimes on one hand, every head injury is a concussion, and on the other hand, even if somebody has a bleed to their brain, which is more likely a moderate or severe brain injury, some people will also call that a concussion when in fact it's worse. So is there any evidence of injury to the brain tissue? Second, does it take longer and longer to recover from a concussion? Third, does it take less and less of an impact to recover or to sustain a concussion? Meaning, one time it might be a big hit in football, but the next time it might be, well, I just kind of bumped my head getting into the car, right? Those are questions that we ask, and the answer is different for every person, but those are the things that we're asking. And then, of course, are there any lingering symptoms from a previous concussion that have not resolved? So that's how we really approach for each and every patient who's had multiple concussions, and we look at our objective data as much as possible. Instead of just saying 1, 2, 3, or 10, we want to make sure we treat the individual person, and moreover, we want to make sure that we help them and make sure they have a healthy future.
Do you still encourage, I know several years ago when my son was playing high school football, they did baseline mental tests, to see, if you do get a concussion, are you back to baseline yet? Are they still encouraging that?
Baseline testing is still encouraged. It can still be helpful. But really the key to any baseline, or any testing for that matter, is the quality of the test. So we want to make sure that they're administered in a proper way. So for example, if it's an invalid baseline test, meaning the person didn't put forth proper effort, then in many ways you're better off not using it at all. And sometimes it can put people in a precarious situation if you have a whole bunch of invalid baseline tests, and then you're looking at a post-injury.
It's useless.
Exactly. It can be useless, and sometimes it can be harmful in the sense that you might use a poor test for a return to play decision.
Wow. Okay, we got a lot to look out for here. You did mention earlier that most people, oh wait, before we get off of sports, what's the best way to prevent sports-related concussions? Well,
the great thing is there are lots of ways to prevent sports-related concussions. The first thing that people always think of is equipment, right? So if we use football as an example, the great thing about the helmet technology is that it is advancing. Even though they look very similar, what we found at the NFL level is for every year of new helmet technology, we are seeing 8 to 9 years of improvement in testing, which is phenomenal and a testament to all those things that we saw in the automobile industry in terms of the materials and the way that things are advancing. if you think about it in that way, then we can see why there have been such improvements. Now, other equipment for other sports may be different. So people always ask about soccer headgear.
Yeah.
Can it prevent concussions? If we look at all of soccer headgear, the short answer is no. However, different materials provide different protection. And so there are resources from different institutions that compares these things, and I encourage people that if they're going to use something like a headgear, that they look at some of the sources for how good is the quality at preventing injury. And then good sportsmanship is actually really important in making sure that athletes are not looking to injure each other. Yeah. Rules. So how often do we applaud a ref?
Oh,
not often.
Not often.
But we should applaud a ref every time that flag is thrown for a safety violation. That's really, really key. So I encourage parents, families, fans, if there's a safety violation and they get flagged for that, encourage them. Our refs are really, they're challenged, right?
They take a lot of heat.
They take a lot of heat, but really when it comes to safety, nobody has to applaud them for making a bad call on a big play. Yeah. But if it's a safety violation, give them all the thanks that you can.
Fair enough. Fair enough. So let's talk about, we have at the Rockefeller Neuroscience Institute, we have the Concussion and Brain Injury Center. Your director. Now, this is a big deal that we have this in our front yard, seriously, here in West Virginia. Can you talk a little bit about the expertise of the team at the Concussion and Brain Injury Center?
We are so excited about the Concussion and Brain Injury Center at the RNI because it is the most comprehensive in the country. So what we have is we have neurologists, multiple. We have physiatrists, so these are people who are involved in physical medicine and rehabilitation. We have neuropsychologists who look at the way that the brain thinks, reacts. We have a psychiatrist because there are mood and behavior consequences associated with brain injury. And then we have therapists for vision, therapists for balance, therapists for thinking, all physically in the same space to take care of patients in the most comprehensive way.
All under one roof.
All under one roof.
All this specialty, and so you don't have to leave the state to get expert care for concussion.
You don't have to leave the state. You don't have to leave the building.
Yeah.
To get this kind of care.
Yeah, and I that's just, and there's 2 locations, right?
Right now there's 1 location here in Morgantown.
Okay. So before we go, what's the most important thing you want our viewers to know about concussion?
The most important thing is to live a healthy lifestyle. And that's what I really want at all ages. That's what I really want to tell people is be active, be physically active. What's good for your heart is good for your brain. Are there activities that could put you at risk for hitting your head and sustaining a concussion? Yes. And if and when that happens, we will take all the precautions to make sure somebody has a full recovery and they have a long life. But we want to make sure that people have an active lifestyle first and foremost.
Okay, well, thank you so much for sharing this information. We covered a lot of ground, and it's a lot of useful information I think a lot of people can use. So thank you for that.
My pleasure. It's an honor to be here.
Well, it's great having you. So that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about concussion, visit wvumedicine.org/concussion. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the new West Virginia Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Cardenas and everyone at WVU Medicine, thanks for joining us.